Hello, my name is Anna Maynard. I am here today to perform check of 3. First, I'm gonna knock the door. Hello, my name is Anna Maynard. Then I'm gonna provide privacy, make sure patient safety. I'm gonna put the bed all the way down, lock the bed, and I'm gonna perform hand hygiene. What is your name and date of birth, ma'am?
Jill Paulette, December 2,
Okay.
1972.
Is that okay if I will do an assessment today?
Yes.
Okay. Do you know where you at today?
VA Clinic,
Okay, do you
Woodville?
know what today's date?
June 19, 2022.
Okay, do you know why you're here today?
For assessment.
Okay, my patient is alert and oriented times 4. Do you have any pain?
No.
Alright, if the patient will answer yes, you have to ask her with the old card mnemonic. Now I'm gonna check on your pupil. Follow the light for me. Alright, look at this and look up all the way over there. Okay, my patient pupil size is 4 per pupil equal, round, reactive to light accommodation. Now I'm gonna check on your neck and to check the GVD distension. My patient is laying 45-degree angle. There's no GVD distension. There's no GVD distension. I'm going to palpate the carotid pulse, one side each. Carotid 2 plus. Then I'm going to listen to the carotid 2 using the bell to check for bruit. No bruits. Now I'm gonna check on your skin. Can you stand up for me, Miss Jewel? Alright, patient, can you pull this one up for me? I'm gonna check on the lower extremities. Skin pink, warm, dry to touch. Muscle tone symmetrical. Turgor elastic. Pedal pulses palpable. 2 plus equal. No clubbing. Cup refill less than 3 seconds. Nails adhere to the bed really good. I'm gonna check on the upper extremities. Skin pink, warm, dry to touch, muscle tone equal, turgor elastic, radial pulses palpable, 2 plus, nails well groomed. I'm gonna check on the cup refill here in the skin, 3 plus, no clubbing. Can you squeeze my hand for me? Grips equal, 5/5. Can you press my hand? Foot press, 5/5. Do you have any limitation of your upper and lower extremity, Miss Jewel?
No.
Okay, good. Now I'm going to check on the breathing. Patient is sitting erect in a position. Breathing is even and labored. Now I'm going to check on the lung sounds. So first I'm gonna check 6 points anteriorly, and then 2 points laterally and 6 points posteriorly. I'm gonna listen to the lung sounds. Breathe in and out for me. Okay, thank you. Breathe in and out. Then 6 points here, 2, 4. Then lower, low. And then lateral, in and out. Breathe in and out. Now I'm gonna check 6 points posteriorly. All right. Breathe in and out for me. Okay. Breathe in and out. All right. Thank you, Miss Jewel. Now, their lungs are clear. All lobes. There is no wheezing, no crackles. Now I'm going to listen to the patient's cardiac rate and rhythm. I'm gonna let you you can stand up, Miss Jewel, while I'm gonna check on the patient heart sounds. So she's not gonna be aware. I'm going to check on the breathing, the heart rate, and the breathing, the respiration rate. So I'm gonna check on the 5 points of the heart. I'm gonna check using the diaphragm and the bell. the 5 points of the heart. I'm gonna check the using the diaphragm first. I'm gonna locate the aortic valve, pulmonic valve, Erb's points, tricuspid valve, mitral valve. Now I'm gonna use the bell to locate the aortic valve, pulmonic valve, Erb's points, tricuspid valve. Right here I'm gonna count the heart rate for 30 seconds times 2. So good. After the pulmonic valve, the mitral valve. All right, the patient's heart sounds are good. The rate is good. There's no murmur. Heart breathing is 18 breaths per minute, and the heart rate is 80 beats per minute. And I didn't hear any murmurs. So now I'm going to assess your abdomen. Do you mind laying down for me, Miss Jewel? All right. First, I'm going to inspect abdomen looking at the abdomen and the level of the eye. I do not see the abdomen around, umbilical is midline, there's no lump. Now I'm going to auscultate, start using the diaphragm, and I'm gonna auscultate using to check for bruit using the bell. I'm going to auscultate first, start in the right lower quadrant, right upper quadrant, left upper quadrant. So I'm gonna auscultate right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Then I'm gonna use the bell to check for bruits. Okay. Abdomen active times 4 quadrant. There's no bruit. Now I'm going to palpate on the patient's abdomen. I'm gonna do a light palpitation first in the circular motion. Start from the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. There's no tenderness, any pain.
No.
There's no tenderness, no lump. Then I'm gonna do a deep palpitation, 2 to 3 inches. Start from the right lower quadrant, right upper quadrant, left upper quadrant, in a circular motion, left lower quadrant. Is there any pain when I palpate deeper?
No.
Okay. There's no lump, there's no tenderness. Thank you, Miss Jewel. When was the last time you had a bowel movement?
This morning?
Okay. Any problem? Any diarrhea, constipation?
No.
Okay, good. Do you have any burning when you pee?
No.
Pain in the abdomen? Good. Do you mind if I get your urine sample later on, a clean catch urine to check for maybe any infection to eliminate? Is that okay if I check your urine sample? Okay, thank you. Do you have any catheter or any drains or any IV sites? I didn't see
No.
anything. Okay, any catheter here?
No.
All right, good. Do you have any limitation of the range of motion of your upper extremities and lower extremities?
No.
Okay, there's no pain, anything like that. Okay, good. Now, patient, thank you so much for letting me do the assessment. I'm gonna make sure patient is safe. I'm gonna lower the bed all the way down. Make sure beds are locked. Call lights within reach if you have call lights, and the bed closer to the patient so they can reach without falling. So thank you so much. I'm gonna perform hand hygiene. Thank you.
Thank you.